Now, how do you investigate for the underlying pathological features and the underlying or etiological features or the etiological points that are contributing towards the development of this comatose condition in the individual? The causative factors would list down as when you take the history, the detailed history is going to reveal a lot of factors for these particular patients. For instance, the history of trauma. Road traffic accidents and any kind of traumatic conditions usually contribute towards the development of this particular condition, and they can affect the cortical regions, the thalamus, as well as the brainstem can be severed in severe traumatic conditions. Then cardiac arrest. The decrease in the cerebral blood flow is going to result in the damage to the certain cortical regions, and again giving you a clinical picture of comatose patients. Circumstances and the rapidity with which the neurological symptoms are developing in a patient. Either it is the acute kind of a condition that you're dealing with, or again, we have a list of chronic conditions that can even result in a comatose individual. Then we have a list of antecedent symptoms. For instance, how was the condition developing in the individual? Was it associated with certain symptoms, or is there any history of trauma? Because fever and different states can basically give you clues towards the infectious states in the individual. So you'd be looking for even the associated factors in the individual as well. Now, the drug history is very important. You would take any kind of prescriptional drugs, recreational drugs, use of alcohol, or drug misuse that can be elicited for these individuals as well. Now, multiple organs, for instance, chronic liver, kidney, lung, heart, and even the other medical conditions also contribute towards the metabolic abnormalities and eventually resulting in the states of unresponsiveness in the patients.